Okay, the last one is a parasitic twin. That happens when one of the fetuses stop developing during pregnancy. The parasitic twin is attached to the other fetus and can grow recognizable body parts. To this date, there are still rare documented cases of this phenomenon for researchers to study.
Wow. I was trying to think of twins that I could make a parasitic twin joke,
I mean,
but I couldn't think of anybody.
You hear of twins absorbing
the
the
only
other
one.
He's a
twin.
fucking idiot.
But they're not twins.
Like-
Yes. Say that again, Tay. Sorry.
You hear of one twin absorbing the other one.
Correct, and that's actually inside their body. Now,
I think there was an X file about that one time.
Really?
Oh yeah,
yeah. And then one was controlling the other from the inside.
and it was pretty cool.
The call's coming from inside your body.
It was pretty cool. It actually would crawl out of the dude. At
Oh,
night
really?
time.
Oh, really?
Yeah, and it would go around wreaking havoc.
And
it would
crawl
call.
back
Yeah,
in.
it would crawl back in and be like, "Who's?" You know, it was like part of a freak show. Who tore up the bathroom last night? Well, I don't know.
And then it's just, if it's an identical twin, it had the same DNA, so the guy would get blamed.
He was
for
he
it.
was blamed for it. So what happened? He was blamed.
Yeah.
It was crazy. It was cool.
That's funny. All right. Well, are we ready to do some phone calls?
Yes,
All
and I'm ready to time you.
Oh, you're gonna.
Oh,
okay. Yeah.
shit.
Number
All right,
one
we
thing,
gotta work at
don't
this.
take advice from some asshole on the radio.
We can do it. We can do
Okay.
it.
You ready?
We can do it.
Wait.
I'm loose.
No, I'm not waiting.
I'm loose.
Okay, let's go.
Hey, Dr. Steve, this is Bill in Texas.
Hey, Bill.
I talked to you in the past about my kidney stones, and
Yes, sir.
you're a very big help to me, and I appreciate it. But I got a serious
thanks, man.
question. Do we sneeze when we sleep?
Oh,
Thank
that's
you
a
for your
good question.
assistance. I appreciate it. Have a good day.
That is a good question, and I know the answer to that. Do you have any insights on this, Dr.
So the
Scott?
answer is we do not, for the most part.
Okay, so during REM,
What kind of an
it's-
answer is
it's
that?
partially right.
That's a partial. That's more of a bill than you
So
get.
in other
you
words,
shithead.
the answer is
I get a partial bill. By God. Yes.
Lord and lady, douchebag.
If you're in deep sleep, you do not sneeze. You can-
See, that's the things that are coming out of your mouth, John. Babbling, insanity, delusions.
so. Yes, people probably do sneeze in their sleep. I did a little research on this, but Scott is correct that during REM sleep, we probably don't sneeze, which is odd.
Yeah.
But if you need to sleep or sneeze at that point, you'll wake up.
Right.
But
I think your brain wakes up if you're going to sneeze, but you don't sneeze while you're sleeping and stay asleep. I don't think.
yeah, well,
I understand.
okay. So I'm looking at
Yeah.
some research here. It says you may have no recollection of it, but there's a chance that you've sneezed in your sleep before. Sneezing in your sleep is possible, may occur at any stage, but there aren't that many studies. I mean, why would you fund a study on this, right?
Right.
But some evidence suggests that sneezing is most unlikely to occur during rapid eye movement sleep. And I do have a reference on that. And that's because of that phenomenon known as muscle atonia, where you're paralyzed during
Gotcha.
REM sleep.
Gotcha.
And, but people move between different sleep cycles when they sleep. So you can sleep in other, at other times. Now I'm looking here. This is, and the page is not found. Okay. Boo.
Have you ever heard of a sneeze while they're sleeping though? I don't think I ever have.
No, I know, but
Not that I know of. Of course, if I'm sleeping, I would.
yeah, if you're
That's the
asleep,
only-
you wouldn't know it.
Yeah.
That's the thing.
I guess, yeah. Unless it's a hell of a sneeze.
Now I cough a lot in my sleep.
Yeah, or you can have post nasal drip. It can
Right, and
cause
I'm
you to choke
coughing.
and cough. Sure,
I'm coughing a lot.
but you
when
know,
I sneeze.
if in bed, there's still going to be pollen and shit flying around. You
Yeah,
can,
of course.
You can breathe in that should make you sneeze, but you don't.
Yeah, this person says no specific sleep stages prohibit sneezing. However, during REM sleep, muscle activity is inhibited to stop us acting out our dreams. This might affect intensity or frequency of sneezing. So that's why it's generally thought sneezing during REM is unlikely, if not outright impossible. But again, who in the hell is going to fund this study?
Yep.
To what end? So there are some things we'll never know
Mhm.
conclusively because there's no data on it. Why would there be any data?
The
on
only
that?
way it's going to happen is if like Taylor Swift or somebody starts sneezing in their sleep, and then
Then
they'll
we
do-
would know.
Yeah, then
Right.
we'll do some
Right, right,
studies or
right.
something.
All right, very good.
Somebody important.
Okie doke.
Time perfect.
Yay!
Hey, Dr. Steve. Yes, this is the topic I know you've talked about a lot over the years, and that is the nocturnal emission or wet dream.
Yes.
And I probably had one or two in my teen years, none at all in my 20s. Now I'm in my early 30s, and I'm starting to get them frequently. And when I mean frequently, I'm talking about like 3 times a week. I live with my fiance. We have sex regularly. You know, 1 to 3 times a week, I would say. But it's still happening.
Yeah.
I don't know what it is. If you can give me some advice other than, you know, maybe beat off before bed or whatever, but this is happening and I'm kind of getting concerned because I'm not sure if it's correlating because I'm also not lasting very long in bed either.
Interesting.
Again, stamina, pretty good in my teen years and my 20s, not so much in my early 30s because, so I'd love some advice if you can, Dr. Steve and the panel, and mainly because I'm a little tired of washing sheets every couple of
I
days.
would be too.
Thanks.
Oh, just don't wash them. Little crusty sheets. What difference does that make? It's sterile.
Yes, it's clean.
It's
It's protein.
Yeah. So here's the thing. He's right. By the way, I started beating off at such a young age. I've never had a wet dream in my life. Never. Not one. So
practice, Dr. Steve, practice.
And I never completed the transaction in my sleep either. Whenever I started having a dream where I'm getting ready to have intercourse, it always ends just as things are getting ready to happen. So that pisses me off.
Dreams come in emulating real life.
Yeah, maybe so. So, you know, the ability to maintain an erection wanes over time. The refractory period increases over time. And generally, people will have reduced number of nocturnal emissions as they get older.
Right.
However, there are a couple of instances where this is counterintuitive. If they start increasing frequency in adulthood, it could be a reflection of a potentially significant sexual stimulation prior to sleep. So he said he's getting it a lot. Maybe this is a new partner.
Okay.
And if he's getting aroused, you know, when they go to bed, even if they don't have intercourse, he may be completing that transaction during sleep. But what I'm also going to say is this can be a sign of hormonal changes as well. So I would get that checked and make sure that he doesn't have some sort of, you know, condition that's causing a dramatic increase in his testosterone or a dramatic decrease in other hormones that are, you know, counter to testosterone. And so he needs to get that checked.
Yeah.
Just in case that's the only sign that he gets. Now, there was a weird study in 2020 that showed that those who watched more than 3 hours of TV today were more likely to experience nocturnal emission. And what the hell that has to do with anything? I don't know.
Hey, another couple questions, Dr. Steve, is maybe what is he wearing or not wearing to bed with his fiance? So I mean, if he's changed from his old cotton briefs to some sexy silks or something, it's rubbing him the right way, or maybe they're just sleeping. You know, maybe they're sleeping in the nude. They used to wear, you know, underwear and then just that having that little bit of stimulation for a man that age. That may be what it is.
Yeah. 41.8% of women report having at least one wet dream in their lifetime. In other words, having an orgasm in their sleep.
And the other ones don't admit to it.
Yeah. Now, regular sexual activity should decrease the likelihood of having a wet dream, but you can't definitively prevent them from happening that way.
And shit increases stamina, you know, stick-to-itiveness. Which, damn it.
Oh, God.
I was just starting to wax poetic. Good luck, buddy. Check your hormones.
Yeah. Lord.
Hey, Doc. I'm 33 years old, 185 pounds. Just recently started the no sugar, no grains. Lost 10 pounds in 1 month. Feeling great.
Yeah.
So it's not bullshit. Question is about a vasectomy. Thinking about doing that, unfortunately. And my question is that going to affect any of the hormones in my body, you know, to turn me into a fat ass or to slow down my metabolism or anything sexual. I don't think it's going to affect my testosterone. I don't think, but
Right.
any insight on that?
Now, if it's going to affect anything at all, it's going to affect you psychologically. But when they do a vasectomy, they are tying the tube going from the testicle to the mechanism where sperm is admixed with seminal fluid that comes from the seminal vesicles and the prostate. And so sperm cells can't get in there. So when you ejaculate cell-free semen. Sperm, the stuff coming from the vas deferens is 2% of the volume.
Mhm.
So if you had, 100 ml ejaculate, which would be a lot,
Significant.
then it would just be 98 ml. So you would never notice the difference.
Right.
And it doesn't change your ability to lose weight. It doesn't change your exercise tolerance. And the only thing, if you had a complication and you had pain in your, in that area, then that might affect your ability to exercise for a while until you got it resolved. But other than that, no. Yeah, it should be totally fine.
And anymore, they're doing them so quickly and like minimal.
Yeah.
Even no non-cut kind of stuff like laser.
And the yes, and they still cut. That's the thing.
Well, they cut going in, yes.
They say
But then
no
they do-
scalpel.
Then they do laser.
And it's a lie.
Yeah.
They'll say no scalpel. And I mean, technically it's true, but the no scalpel vasectomy uses really sharp scissors
yeah.
or a laser
Yeah.
or any of these things. They're still cutting the scrotum.
Mhm.
They're just not using a scalpel.
Right.
The physical tool that looks like a knife,
Mhm.
but they're still
going
using
in.
a knife.
They're still going in.
Yeah, so don't be fooled by that.
No. And it's going to hurt a little bit.
Yeah, well, yeah, mine was fine. I highly recommend go get a pitcher's cup.
Mhm.
For real.
No, yeah. Those things can be handy.
Yeah, you get a pitcher's cup and you wear it, and then your nuts will not touch anything, and it's fun. You can walk around the hospital or whatever, and just take your fist and pound into your crotch,
Which he did.
and freak people out, and then they hear like that when you do it. It's funny.
God.
I did do that.
Oh my
You got
goodness.
your scrubs. How'd your vasectomy go? And I'm like, boom, 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 just punching my crotch. I can't feel a thing.
Oh my word.
Yeah.
Oh.
And no seeds, no nuts will probably help as well, because there are phytoestrogens in seed oils, and Vinnie Tortorich has taught us that over the years. And what they're concerned. Okay, I'm going to ask for an extra minute because I'm doing another thing. The common omega-6 fatty acid, linoleic acid, they feel is converted into arachidonic acid in the body, and that may increase inflammation in the body. So that's why Vinny pushes the no seed oil stuff. So, canola oils and stuff like that. There are a lot of health warnings regarding that. A lot of the latest research doesn't necessarily back that up, but what the hell? I mean, there's a whole subreddit decrying the use of seed oils. I think it's fine. It's not going to hurt you to avoid seed oils.
Mhm.
And the no seeds, no grain thing is a decent way to lose, it's a decent lifestyle that you can keep up to help lose weight. It's reasonably healthy if you do it right. Okay. I relinquish my time, Mr. President.
Thank you. 16 seconds left to go.
Oh, yes, Dr. Steve. I was trying to call and talk about my 3 testicles.
Okay.
I have 3, count them, 1, 2, 3 testicles. I was born with 3 testicles. I was wondering if you ever heard of anyone
Of course.
that had 3 testicles, such as myself. Apparently, you're too busy
What?
playing some music.
What?
Hey.
What? Wait a minute. What? Hang on. Don't start the timer yet.
You're too busy playing some music.
Okay. I don't know what he's talking about there. All right. the presence of 3 testicles is called triorchidism.
Orchidism.
Yeah. So if you have orchitis, then that is inflammation of the testicles. And so 3 orchids would be triorchidism. Okay. Or yes, that's right. Triorchidism. Good Lord. So anyway, there is a whole group of these conditions called polyorchidism. And these are people that'll have more than 2 testicles. It's rare, and it's caused by an abnormal division in the genital ridge when we are a fetus. Now, I challenge him to determine whether he really has 3 testicles or what he has is what double vasectomy Todd had, which was a spermatocele.
Okay.
He had a cyst that was filled with vesicle or a vas deferens fluid that looked and felt like a testicle, but it was not actually testicular tissue. Now, a lot of times these people will have inguinal hernias. They may have a testicle that doesn't descend properly. They can have torsion. They can also get hydroceles, and then they can get hypospadias, which, if everybody remembers, that's what Bobo had, where the urethra doesn't open up at the end of the penis. It opens up on the bottom side of the glands. Okay. And usually these people have a mass in the scrotum, and they do a Doppler ultrasound, and then you just avoid surgery. They should be followed up yearly by ultrasound for life, just to make sure that something else hasn't happened.
Cancer or something.
But yeah, if it's a hydrocele is filled with fluid, clear fluid, also can sometimes feel like a 3rd testicle above one of the testicles, and then the spermatocele is filled with fluid, but it's
thick.
It's vas deferens fluid. Okie doke.
Yeah.
So if you haven't done it, you need an ultrasound of the scrotum, and then go from there.
Right on.
And I'm going back to play some music. So,
By God.
25 seconds
because you're
left.
too busy playing music.
At least he called it music.
Yeah, that's true. Yes. Oh, I guess maybe he's talking at the end of our show. For those who are not aware,
about to rock,
we play something that we refer to as music at the end of the YouTube recording, which you can join us at youtube.com/@weirdmedicine. If you see it live, you can see the music there. Otherwise, it's on our Patreon. So I can just torture the poor people who actually pay for content. And I send that stuff over there and call it the dregs. And I'm sure that just seems disrespectful, but it's, it's content that nobody else can see. Anyway, but yeah, do check out our Patreon. We're doing some other things there as well, not just throwing shit that we don't want other people to see. Really what it is we get these copyright
Content
strikes.
yeah.
And then we can't monetize the regular video. So we're not really doing a video podcast, but we do a radio show that we record, that we, have turn the cameras on so people can sort of see behind the scenes. So we're not really trying to do a live stream sort of situation. But anyway, but you're welcome to join us. Okie doke. Next.
Hey, Dr. Steve, Dr. Scott, Casey.
What's up?
You guys are doing a great job. I really enjoyed the speeded up comments. I still think for Casey to enjoy it, you need to get like one of those bells like they.
Oh, did we do this
I
one
think we
before?
did this one.
About organ donation? Okay. All right. Yeah. Okay. Sorry. Well, anyway. All right. Oh, yeah. We did this one too. Unlimited funds. Okay. White blood cell. Okay. Let's try this one.
Hey, Dr. Steve, it's Dr. W here. Another
No, we did this one too.
dentist,
Damn it.
yeah, the dentist.
Oh, way to go.
I didn't delete
Oh.
any of these from last
Whoa.
week. This is what I did.
I'm just glad he wasn't suggesting give Tacey a taser or a little, put a little electric shocker around her ankles.
When I was a kid, there was a movie called The Tingler. And it was a Vincent Price movie about this thing that would get in your spine. And what they did, the gimmick was they put this thing in everybody's seat in the theater, and during certain parts of the movie, they would hit a button and everybody get a shock on their ass.
No.
Yeah, absolutely.
Oh my word.
Yeah, if Kaylee from Once Over with Kaylee did a thing about it, and
oh my god,
I told her I was probably the only person that watched that video of hers that actually sat in the theater. And if I can't remember what they called that that device, but what if we got something like that?
Oh my
and then you could shock
gosh.
us.
I'm afraid she would probably abuse her privileges.
Yeah, let me see.
I think she would enjoy it way too much.
I do like to yell Tom.
The
so-
creature earned its name by making the spine of its host tingle when the host is frightened. And let me see, released in the United States, a Tingler received mixed reviews. Yeah, it was pretty terrible, but it's gone through critical reevaluation, is now considered a camp cult film. And I'm just trying to find here if they showed where what that thing was called. But anyway, okay, gimmick. William Castle was known for his movie gimmicks, and the Tingler featured one of his best. It was called Percepto. Previously, he'd ordered a $1,000 life insurance policy against death by fright for Macabre, which was a movie, and sent a skeleton flying above the audience's heads in the auditorium in House on Haunted Hill. Wow, the gimmicks for the Tingler increased the film's cost from $400,000 to $1 million. But the gimmick was called Percepto, and they attached electrical buzzers to the underside of some seats in the theater where the Tingler was screened. Percepto, with an exclamation point after it. Things were just so much simpler back then.
That's pretty cool.
Anyway, okay, this does not count as where were we? Okay, well, we're not answering a question. All right, let's do this one. So maybe we could consider that. We could do something that would be a consequence. If we go long, Tacey pushes a button instead of just screaming Tom into the.
I think she enjoys the yelling time at us.
Yeah,
the thing is both.
I could give you a
freak
stream
out.
deck over there where you could push different buttons and do buzzers and stuff
I'm
too
fine.
if you want. Okay, all right.
Hey, long time caller, first time listener. Wait, that's backwards. Anyway, it is getting into poison ivy season.
Oh, bite your dirty.
I just
tongue.
hate that shit.
Yeah, it makes three of us.
What's the best course of treatment for dealing with poison ivy other than just keeping your ass away from it?
Well, that won't even help you because poison ivy is caused by a volatile oil on the surface of the plant. And on a still day, if it's hot enough, that oil will, turn into a gas. And if you walk through that cloud that's just sitting there on a very still day, you can contract poison ivy because it is dosed in parts per billion. Now, people will think that they scratch it and it spreads. That's only true if you haven't washed yourself in the last week, because soap will get rid of the oil. It is soap soluble. But what really happens is if I have 10 parts per billion on my wrist and 1 part per billion exposure on my shoulder, on my elbow, for example, then the 10 parts per billion area will come up first. It's called a delayed type hypersensitivity reaction. Blisters, itching, redness,
Miserable.
and then it will work its way up, and the 1 part per billion will come up maybe 2-3 days later, and so it looks like it's spreading, but the exposure was all at the same time. So if you know you're exposed, washing, and they used to say Octagon soap, it doesn't really matter. Any soap will do, but wash yourself thoroughly. And then if you do contract it and it's severe enough, it's blistering and the blisters are bursting and you just can't stand the itching, then your primary care provider or a dermatologist or really anybody could prescribe a steroid dose pack. That really, the first time I had a steroid dose pack for a poison ivy attack, it was like sweet relief. Within a day, the itching was gone. And now you're tempted to stop taking the medicine. Don't. You got to finish it. And, by the end of it, it was completely dried up and done. So that's really the thing. But the prevention is the key. And don't burn the shit.
No, hell no.
I've seen places where, at campfires where people were burning poison ivy. Don't wipe your ass with it. So which means number one, it's 2024. If you're going camping, bring toilet paper with you. Don't be wiping your ass with leaves anymore. It's first off, you're just leaving stuff behind.
Biodegradable toilet paper.
Yeah. Yes. Exactly right.
Yes.
Don't camp.
Or don't camp. I like that.
Yeah.
And I used to have a sun shower. It's just you fill it up with water, you set it out in the sun, it's black, and then you have a nice hot shower. And you could actually use it as a bidet if you really were smart and figured out how to do that. So
just do a handstand.